I became a nurse thinking I'll be a psych nurse. My mom was actually a nurse. She said that she saw something in me that will flourish as a nurse. She encouraged me to go into nursing school and pursue psych nursing.
I know that there could be nurses who are trying to diversify their income or even step into real estate. How can somebody get started, like very, very basic?
I would say 3 things. First is to invest in yourself first. So educate yourself. The second is to set a goal with a timeline. Third is to believe in the small steps.
What inspired you to start that journey of teaching students, especially in Korea?
The first one is to let Korean nurses about diverse nursing paths. The second one is to help improve their financial literacy. And nursing education was always something that I wanted to pursue. And that's one of the reasons why I do the YouTube Rich Nurse.
Welcome to the Nurse on Purpose podcast, where we challenge media stereotypes about nursing and spotlight the incredible and diverse roles nurses play in healthcare. I'm your host, Nello. Every week, I'll be joined by a nurse who is reshaping the narrative. From frontline care to leadership, education, innovation, and beyond. Our aim is to show the world that nursing is so much more than what we see on TV. Together, we'll explore how we can collaborate with media and other stakeholders to create authentic and inspiring portrayals of nurses. Let's begin the conversation and ignite change, one episode at a time.
Hey friends, welcome back to the Nurse on Purpose podcast. Oh, I'm so excited. I'm sneezing already because today's guest is such an amazing nurse that I happened to meet recently. Her name is Jiwon Lee. Jiwon is a nurse of 10 years whose career has taken her through med-surg, ER, infertility department, pediatrics, dialysis, and more. She was born in South Korea, went to high school in Toronto, and studied nursing in Boston. And she's now living in Nebraska, where she's doing something really special. So Jiwon is the creator of The Rich Nurse, which is a YouTube channel where she teaches Korean nurses about the many paths available in nursing and how to build financial freedom along the way. She's also investing in real estate and dreaming big about creating assisted living homes that respect and preserve the dignity of our elders. In this episode, we're going to talk about her winding journey through nursing, exploring various specialties, and now real estate investing, and how her values have guided her every decision that she's made, and really what it means to build a life with purpose as a nurse and beyond. So let's get started. Welcome to the podcast, Gia. I'm so happy to have you here.
Yay, thank you for inviting me.
Yeah, I know we are like two little kids just excited about each other. So I met Jiwon through another one of my guests, Mirini. When we connected, I was telling her that I had plans to go to South Korea very soon. And Jiwon was like, oh, let me connect you with a nurse. Well, I asked her if she knew a nurse in South Korea. And she said, yeah, let me connect you with a friend, Ji Young. And from that, we just kind of hit it off. And Ji Young, who I met in Korea, was fabulous. I feel like she should be like a tour guide for real because she was awesome. She is a recent grad from nursing school, and I'm going to be featuring her also because we shot an episode while we were there. She took us to have Korean barbecue.
Oh, wow.
When I'm telling you, from that moment forward, when I reached out to her, she was like my guide, and she was like, okay, this is where you need to visit. These are the things that you need to do. Stay away from this stuff, like do this instead. She was so great. And she just kind of took me by the hand and helped me through. And even after we met up, days after that, she would be like, okay, so what's your plan today? And I would tell her my itinerary. And she would be like, okay, do this, but you can check this off. Like, you don't need to do this. Do this instead. When you go to Busan, make sure you go to, Gwangwali Beach. And I'm like, oh, I love this. I'm
so glad.
She's wonderful. Hyundai Mall. Don't go to this other mall. Like, you can skip this because we had only a week, right? Jiwon, I was telling you, this was one of those trips where it wasn't planned at all. Like it wasn't like we were like, oh, we should go to Korea a year ago and we decide, no. I love K-dramas, and my husband, who doesn't even really like to travel like that, he doesn't like to be on planes. He likes the trip and the vacation portion of it. He all of a sudden had some space in his schedule for a vacation, and he was like, we should go to South Korea. I was like, boy, if you don't stop playing with me.
Stop it.
Stop it, please. Don't say that. And he was like, no, for real. Because, I told you before, Asia was never on my list of places to go. I'd always really been like, oh, Caribbean and Mexico and those kinds of places. But, when I got into K-dramas, like maybe a couple of years ago, I was like, oh, it kind of be nice to go to Korea. But it was one of those things where you're like, I'm saying it, but I know it's never going to happen. Probably like maybe in another 10 years. Like, I don't believe it's going to happen. And he was like, let's go. I'm like, you're kidding. And he was like, no, for real. And we bought the ticket that same day. I was like,
oh, amazing.
Oh my gosh. He's like, yeah, I didn't have a week to go. I'm like, oh, wait, that's not enough. But anyway, long story short, booked the ticket. I was amazed. I could not believe it. We haven't gotten to travel much, but this was one of those trips that was unforgettable. Thanks to you.
I'm so glad.
Yeah.
I am so happy to hear that.
So yeah, thank you for that connection. It was great. Let's kind of get into it, okay? You have so much going on with you, but let's first dive into what inspired you to become a nurse, and then eventually how that journey led you to pursue a master's degree in health leadership and nursing education. So we want to start with the basics.
Yeah, thank you for the wonderful introduction, Nello, and I'm very happy to be here. Yeah. Thank you for the invitation. I became a nurse initially thinking I'll be a psych nurse. In high school, I thought that I'm good at listening to other people. I enjoy empathize with them. And my mom was actually a nurse. So she encouraged me to go into nursing school and pursue psych nursing.
That's amazing.
So I did. And I went to a school in Boston in nursing school. And then during senior year in college, I did volunteering at a suicide hotline at Samaritans. And also I did my clinical at Psych Med Surg, and I realized that I was not good at drawing boundaries with psychiatric patients. So I was crying on the way back home, doing psych clinical because my patient's story was so sad to me. So I realized that maybe I should do something different and then see where it leads me. And if I still like it, I'll choose. And it has been 10 years since I graduated nursing school. So I did, as you said, med surg, infertility, emergency, general pediatrics, and different things. And now I realize that's really what I enjoy doing and what I like, psych nursing. So I'm pursuing a psych NP program.
Wow.
I'm adding more to my plate.
I thought that was it with the nursing education and leadership. Now you're doing psych too. I
know, right? I would not imagine either. I was like, when I was graduating in 2018 with my master's in health leadership and nursing education, I was like, I'm done with school, but I'm going back.
So ourselves.
Yeah. And I did health leadership because it was unexpected. I initially started with family nurse practitioner student, and then I failed my practicum. It was a year after I graduated from nursing school. Back then I had dialysis experience, and I guess I didn't really know how to tie the knowledge that I learned from school to the actual life and clinicals and the skills. So the school recommended that I go back to Korea and practice a few more years and come back. But because of my visa situation, I couldn't do that. So I chose to deviate and did non-clinical route and did major in health leadership and nursing education. And nursing education was always something that I wanted to pursue. And that's one of the reasons why I do the YouTube Rich Nurse. And then I graduated and learned so many different fields in nursing that I did not know.
Yeah.
And we'll talk more about that. So that's how I got into my leadership program.
Wow, that's amazing. So a couple of things. Thank you for being vulnerable by the way, about failing that NP practicum, because of course a lot of people do, but most people are not willing to talk about it or share their experiences because it is very traumatic, right? To have worked so hard and then to fail at something. But hopefully the lesson here is that that helps you discover really where you wanted to go moving forward. Then the other thing was just really something you mentioned. I'm trying to remember it now. But you had said, oh yeah, you said you went back to psych, which sometimes we take one experience that we've had and something that we're passionate about, and because of that experience, we decide that the entire thing is not for us. So we throw the baby out with the bathwater instead of saying, okay, how can I figure out how to better draw boundaries, right? And then continue to push through, right? Because I feel like you left psych because you felt like, okay, I can't draw boundaries with my patient.
Yeah.
And then you kind of went exploring all of these fields, which still no knowledge is lost, came back and still worked out for you perfectly well. But now you went back to psych, having understood that I'm sure there is a way to draw boundaries and still remain connected with my psych patients. Does that resonate?
Right.
Yeah. Let's go ahead and talk about your huge success on YouTube as the rich nerd. Girl,
I don't know about it.
yeah, no. I mean, you are when you're clocking tens of thousands, that's big. So that's amazing.
Thank you.
First of all, how did you come up with the name The Rich Nurse? And what inspired you to start that journey of teaching students, especially in Korea?
The reason why it's called Rich Nurse is because the channel has two purposes. The first one is to let Korean nurses about diverse nursing paths. The second one is to help improve their financial literacy. So I wanted it to be speaking itself. That's why I called it Rich Nurse, and it's easy to remember. So that's how I named it. And the reason why I started it is that I thought YouTube was a platform that's endless, and I can reach to anyone from a big city in the United States to in Korea, where they can listen to the interviews that I do, like yourself, Nello, with a lot of different nurses in different fields. I can study different fields and then I can talk about it, but it's, I believe, more valuable, more in depth with insights when I invite and interview other nurses who are actually in that field practicing and working.
Yeah.
So that's the reason why I picked YouTube, and then why I started the channel.
Yeah. And what kinds of things do you address when it comes to financial literacy?
I like to talk about real estate in my channel. And also I do like stocks and 401k, Roth IRAs, and those retirement accounts. Because when I started my nursing career, I had no idea about these different types of investment and what I can do and how I can do it. So that's why I want to introduce them, because I wish I knew this when I started my nursing career. Because, compound interest and the power of the compounding, I truly believe in that. And it's more powerful when you start it when you're 25 versus, when you're 45. So that's what I want to deliver in the channel. And also, I love real estate. I enjoy it. We can talk more about it.
Yeah, no, talk about it. What was it that led you to have this passion for real estate? And what can you tell us about investing in real estate as it relates to building wealth?
So when I was working as an emergency room nurse in New York, I was so burnt out. And it was during COVID. It was in 2021, 2022, 2020. So I was working and then came home and realized that, can I do this for the rest of my life? And would I be able to achieve a life where I want to, I can do what I want to do, where I want to do, with people I want to do. And I have family in Korea. So I wanted to go to Korea when I want to see my parents and things like that. And I was like, maybe I need to find different income streams or find another way that I can create financial stability. So I started reading books, listening to audiobooks, podcasts, and watch YouTube videos. And they said more than 90% of American millionaires built wealth by real estate. So I was like, what is there? Like, I'm curious. So I initially started with the investments through stocks and retirement accounts, but I don't have a husband. I don't have children. So I realized that maybe the house hacking method in real estate is what I can do, which is an owner buys the real estate or the property and live in it and also rent a portion of it. What I did was to bought a condo with 2 rooms and 1 bathroom, and I lived in the living room with dividers. And then I was living there and I rent 2 rooms that I had. Now, thankfully, I'm living in a room in the same condo.
Now it's your house. You live in a room.
Yes. So I'm renting out the other room.
Okay.
But it's a form of house hacking, and I recommend other nurses, especially if they don't have family yet, to do the similar method. You don't have to do the way I did. You can rent out your basement. You can rent out a accessory dwelling unit if you have one. You can rent out a separate unit if it's multifamily house. So that's what I talk about in the channel too, and what I want to spread, that there are other ways that you can create income.
Yeah, well,
other than a nursing job too.
Yeah. So does your rent, or the rent that you collect from your tenant, does that cover your mortgage, or how does that help you to then build the wealth?
Right. So I'm in New Jersey right now, across from the Hudson River from Manhattan. So the rent is pretty high here. When I was living in the living room, I paid about $600. It didn't cover 100%, including the resident paid my principal and interest. My homeowners association fee I had to pay, like taxes and stuff like that, insurance. And the upstate New York house that I have, it's paying for itself.
Very nice.
Yeah.
How many properties do you have currently?
2.
2. Oh,
Yeah.
awesome. So you have 1 in New Jersey and 1
in upstate New York, in Rochester.
Oh, wow. That's prime location.
And yeah, a lot of investors out of state are coming to upstate because it's relatively cheaper. And yeah,
that's amazing. All right, so you said that your channel is twofold. The first thing is that you teach financial literacy, and you've kind of talked about that piece. Now, what's the other piece?
It's for myself, I guess. It's for my learning. It's like kind of selfish, but I want to grow as a person. And it doesn't have to be like a humongous like achievement of success. Like in conversation with Yanelo, it's a growth in itself too, because it's a public speaking. I learned to summarize my path as a nurse and my investment, and I can talk about it, thankfully, in front of many people that listen to your podcast. So it's a growth, and also through meeting people that I have never talked to. Like I invite real estate investors too. We had attorneys, different professional folks who can speak on their life and also their investment journey. So that's also a learning for me. So that's a hidden purpose for myself of the YouTube channel.
Yeah, self-development for sure. This has been for me also kind of self-development venture, even though it didn't start off like I didn't think it was that route, but I wanted to just disseminate this message to the public about nursing. It's ended up building my own, I guess, passion for nursing, to be honest. And then the public speaking. It's like every day you do the same thing. Eventually you're going to start getting it, right? And I don't feel like I've arrived yet. There's still some things that I'm like, oh, I stuttered here and I did this there. And then we're both from foreign countries. So we have the accents, and we're like, balancing it all can be an act. But I'm proud of you, and I'm proud of how much your channel has grown. It's amazing. What are some questions, like do people reach out to you a lot and ask you things about like nursing school, about America, about living here, about working here? What are some of the most common questions that you get from your audience?
A lot of questions I get from Korean nurses is about adjustment to the life here. So whether it be speaking English and taking care of patients in English, of getting adjusted to a new culture.
Yeah.
Like, for example, even setting up internet at home is totally different. Buying a car, let alone, can be very stressful. And when you're a nurse, you communicate with so many people in the hospital, patients, physicians, other nurses, social workers, and so on. So you have to make calls, you have to talk to them in person. So there is a fear. And I was like that too. I understand 100% when you are in a new country, you understand Nello too.
Yeah.
In a different environment with different people, using different language, culture. It's very stressful.
It is. It is.
Yeah. So those are common questions that I get. And also, how do you overcome when you are burnt out?
Yeah.
That's another question that I get, which I'm still learning myself and what is the best way because everyone's different.
Yeah. How do you overcome those barriers? Because people are moving not just their careers, but their entire lives, you know? Some people have kids. Some people still need to figure out the visa process, you know. I recently interviewed a nurse who came from the Philippines and now has sort of a transition to practice initiative that he helps nurses in the Philippines who are transitioning to the United States get settled. And actually what they do is they take the program to the Philippines before they ever get to the US and start to teach them the US model, right? So whether it's the EMR that they are going to be using, because a lot of people are still on paper. So they start to transition them with the EMR, teaching them how the patient volume works, how meds work, like how meds are administered, just kind of training them, but then also helping them with other life things. Like there's so many other aspects of life moving to the United States, just like you mentioned, beyond the clinical skills, because you already have that. You've already been practicing as a nurse, right? But there's so much other things like, you know, getting housing. How do you like get a car? Like, what do you do about that? Where do you live? Like, there's just so much that goes into moving your whole life over that I told him, I said, you know, I have connections with other countries too, that if he ever wanted to like step foot in another country, continent or whatever, that I would be willing to do that because that's such a great thing. A lot of people are transitioning internationally to the United States, and just helping them to adjust to life here is the major thing. It's different when you come here. Like when I came here when I was young, but it's a whole different ballgame coming when you're the full grown adult. Like you're not under anyone's care. Your 20s, you're starting your life. There's a lot of adjusting to do. So really grateful and glad that you're doing that for Korean nurses. Ooh, I was so happy to be in Korea. I can't tell you. I keep going back to that. Oh my goodness, the food was so good. The people were so kind. The service is just amazing. You can ask me whatever you want because now I'm more Korean than you do. Proximity. I just was there, so.
Anyone who listens, ask Nella about Korea.
If you need guidance on Korea, Jiwon, you can ask me. I got you, girl.
That's so funny.
That's awesome. So I know that there could be nurses who are trying to diversify their income or even step into real estate who may be feeling intimidated by just the real estate monster. Like it just seems like such a big world to step into because there are so many facets. You know, people talk about commercial real estate, buying apartment building, Airbnb, like there's so much. How can somebody get started like very, very basic if they don't want to throw all their money in or they don't even have that kind of money to buy a whole house to house hack? What are some other simple ways that they can invest and still see return?
I would say 3 things. First is to invest in yourself first. So educate yourself, whether it's a free YouTube video or reading a book or listening to a podcast. The second is to set a goal with a timeline. So when I started with a PDF file made by Bigger Pockets. It's one of the largest real estate website and like a forum where you can meet different people. You can educate yourself. And there is a PDF file I can share that lets you know every day for 30 days what you should do to buy a house. So from applying for pre-approval letter, meeting a real estate agent, reaching out to a real estate attorney, and so on. And every day there's a podcast that you can listen to, and they're free. So set a timeline. And the third is to believe in the small steps. So it might not you might not be able to buy a house, next month, and that's okay. Just believe in the small things in one episode that you listen to today and building up from there, because the first time is always the hardest. The first patient we took care of, the first assignment that we had, it's always the hardest, the most frustrating. And we feel like we don't know anything, but that's okay. You will grow from here because you took the first step, and that's the hardest and that needs the most courage. So just kudos to you if you told yourself you're going to start making different streams of income, whether it's real estate, stocks, and whatnot. And speaking of house hacking, I started with $30K when I bought the condo, because I put down 5% of $440K condo. And I was able to do that because I lived in the condo. It was my primary residence. That's why I could put down as little as 5, and you can put down as little as 3 to 10% if you buy a primary residence. So that's why I recommend house hacking for people who want to get the foot in the door when you are inexperienced. So you can have a place you can live and also have build skills managing property and deal with the residents, tenants, because there are a lot that is unexpected that you will encounter. And it's also like taking one step at a time that you will get better as you go. I'm also learning, I don't know everything. So
you have
that's what
such
I
a
would
soothing
say.
voice. I feel like I want to play one of your videos. Point. I was telling her that like Korean voices are so calming. Like they're either like or they're like 안녕하세요. 감사합니다.
You got it. You got
Gosh,
it.
keep talking to me. But yeah, thank you for giving back that way. Okay, so let's talk. One of your long-term goals and visions that you shared with me before is that you want to build an assisted living facility, and not just anyone, but like one that feels like home. Can you tell me more about that vision and what that means to you?
When I worked as a med-surg travel nurse in Boston, New York, I went to a lot of hospitals where they have designated units for people who have no discharge plans or place to be. And patients stay there from months to years there. So they don't have family, they don't have financial means, or waiting for the court to make a decision who can decide where they go for that. So I realized there are safe discharge places that needs to happen for those patients. And also, when we get older, for some reason, even though we all get old, everyone dies. There is I feel stigma when we become older, and people don't want to be around like senior communities. And that's why I wanted to create an environment where seniors can have the later stage of their life live with dignity in a home-like environment. That's why I want to avoid the commercialized like big boxes. I want to do 6 to 10 bed small.
Wow.
It looks like a single family house.
Aww.
Yeah, that's what I would like to do. And also for the Korean community, because when you get older, you want to keep your culture, you want to speak your language, you want to eat your food. So that's why I started dreaming about building an assisted living that's home-like and where you can keep your dignity at the later stage of your life.
That's amazing. And it's interesting that your experience with real estate is already going to be playing into
Mm.
either building or obtaining a facility. So every knowledge that you've gained so far is really leading you into this future that you envision. And I think it will be wonderful. I want to live there.
I'll invite you when we get older.
I want to live there for real. What role do you think compassion plays in elderly care? You know, you mentioned that a lot of people don't really want to be around the elderly, which I think it's kind of silly because you can learn so much from the elderly.
Right.
How do you envision bringing dignity and joy into their lives? Like, what would you want to create? What activities would you like them to engage in? Whether it's like cooking, I'm thinking out loud for you now. I'm building your dream.
Awesome.
But whether it's like a cooking class or playing games that they used to play in childhood, like what do you think? What kinds of things would you want to have in that facility?
Community
Mhm.
is the most important. So what you mentioned about cooking classes and the activities that we can create for the seniors will definitely add to the joy, and also not isolating them.
Yeah.
I think that's important. So eventually, did you go to Japan? You went to Japan
No,
with
I
Korea?
only,
You didn't.
I only went to Seoul and Busan.
Ah, okay,
I
okay.
wish.
And you stay for a week.
Yeah, yeah. Well, I
Okay.
stayed in Seoul for 4 days. First 4 days.
Uh-huh.
I went to Busan, did 2 days, and I came back to Seoul for the last day and flew out from Seoul. It ended up feeling like enough.
Uh-huh.
It ended up feeling like enough. Like if we stayed for an extra week, I still would have been happy because I saw when we were coming from Incheon airport, met some people who were coming from Japan, and they were like, "Oh, it's only an
Yeah.
hour." I'm like, see, we should have done like at least 2 countries." But it felt
Next
like,
time.
yeah, I know. Listen, there is going to be a next time. It's one of those places.
Yeah.
Like I've been to several places, and I'm like, I did this, and I'm good. Like I don't
Uh-huh.
have to do it again. But South Korea is one of those places where I'm like, yeah, you are definitely getting like like an encore. you know?
Right. Maybe you can come when we are both there, and I'll show you around.
I will totally come. I don't even have to bring anyone. My husband doesn't have to come. I can come by myself.
I'll show.
Or with my sister. My sister also. She was so mad at me when I told her we were going to Seoul. She was like, "How could you go without me?" I'm like, "Sorry." But
Yeah.
it'll be fun. Let me know though. Like,
Okay.
yeah,
I'll
we're
do.
in each other's lives now forever.
Yeah.
Whenever you go, just hit me up if I'm available. Maybe we can
Yep.
make it work.
Yep.
All right, sorry. Go ahead.
So I asked about Japan because in Japan there are communities where there are assisted living, senior living, there's kindergarten, there's schools, so they're all together. So when a senior walks around, they can see kids, they can see younger people like going to school. So I think that exposure, it can energize them too. So we don't have to segregate them, like isolate them in the middle of nowhere. That's not what I envision. So eventually they'll have to be in the society. Like we are born into the society, raised by a family, and then we die. So I think that needs to be in continuum.
Yeah. Amazing. I'll ask you this one last question about Korea, and it has to do with nursing in Korea. You talk to nurses in Korea, you're connected with nurses in Korea. What are some of the ways nurses are perceived in Korea versus like your perception of how nurses are regarded in America? And what are some of the challenges that you feel nurses in Korea are facing?
One of the big things is the societal respect towards nurses that are different in Korea versus in the United States. For example, when I get on Uber and tell the driver that I'm a nurse, I often hear, "Thank you for your service, thank you for what you do," because here it is perceived as a profession that gives. Unfortunately, in Korea, the perspective to healthcare professionals and nurses have shifted since COVID because in a lot of media and news, they are portrayed as people who were giving during COVID in the middle of the influx of patients in hospitals and in communities, and they have seen that. But especially before and since they're working on lifting our reputation and profession and what we can do and how we can influence the society. And that's one of the reasons why Korean nurses would like to come to the United States to practice, because there are many other avenues that you can grow as a nurse, whether it's a nurse practitioner, whether it's management consulting, you can be informatician, the different ways in nursing, and also the respect.
For sure. What are some challenges that they face beyond like that level of respect that we're still kind of working to achieve? And it's not just in Korea. I'm Nigerian. It's similar story there as well. And in many parts of the world, and even in America to some degree, it's just that because America tends to kind of be faster than the rest of the world, it appears that we are much more respected here. However, we still have a ways to go. But what are some of the challenges that you face, whether that is in policy or, in the boards of nursing over there, whether it's in the education, whatever it is that you feel nurses might be really wanting to change or do something differently about in Korea?
Last few years, we had resident strikes in Seoul, in large academic institutions and large hospitals in the city. So nurses had to take a lot of responsibilities and do jobs of interns and residents without proper education or any support, if let alone something happens. In terms of legal issues, they can't be protected. And the nurses who do prescribe and diagnose, they can't do that legally because there is no structure or educational system that they can do. And interestingly, they are called physician's assistants, PA, but they are nurses in Korea. And that is one of the big issues that South Korea is handling. And the government is trying to pass a bill where they protect nurses who work as a PA and support providers in making diagnosis and then also support making prescriptions and things like that. But that's still in progress. And the nurses who are working as a PA, they are left unprotected still. So that is one of big challenges. And there's no financial incentive as well. It's just in a hospital, if you are a nurse with 3 to 5 years of experience, they just ask you if you want to be a PA, and then you support physicians because there's a lack of workforce right now because of the strike.
Why are they striking?
They're striking because they want to. So the medical colleges in Seoul, they want to increase the number of medical students. And then the medical association in Seoul, they think that they're going to lower the reputation or the standard of education. And they don't think that it's going to resolve eventually the issue of increasing the number of physicians working in countryside outside of the capital city. And that also I understand. And there are rational and reasonable reasons why they do that. It affects the citizens of Korea, and that's why it's affecting the workforce, and people are turned away from emergency rooms because they don't have enough providers to care for them. Yeah, so that's
basically we're saying that if they accept more students into programs, then the reputation of medicine or medical practice may now be lowered. Is that correct?
Right. Okay. Yeah, like for example, if you had a medical college that 1,000 students
Right.
versus 3,000 students.
Right.
Like you'll need more
More
medical
people, and then you might be accepted
professors and
to people whose
facilities.
grades are not like that high or whatever, things like
Yeah,
that. I see.
exactly.
Huh. That's a tough one. It's really tough to, because you're still training them in the school. It's not like you admit them and then you don't teach them, right? You're teaching them to become physicians.
Right.
And I think sometimes schools can pay more attention to numbers, like grades numbers, than really the quality of the student that's applying. So it's a double-edged sword, because while I get it, and
Right.
I always say that in nursing, we can kind of take a page from that book, because we tend to, some schools may just accept people for the financial benefit without really understanding, like, what is this person bringing to the school? Are they bringing values of compassion, of integrity, of having that patient advocacy mindset? Or are we just accepting anyone that can pay for it,
Right.
So there are two sides to the coin, and so I kind of understand it, but I also think you need to tread with caution and treat this on a case by case basis. But thank you for sharing that. That's crazy that then nurses have to bear the brunt of that, and without proper compensation. So let's move on. It's really cool that your mom encouraged you to pursue nursing. As an immigrant parent, for you to pursue nursing, because a lot of times you don't hear that. People are like, no, they'll be a doctor, especially Asians, Africans. We get that a lot. So that was really cool. Was she a nurse in Korea?
Yeah, she was a nurse in Korea. She was in academia mostly, so she didn't practice many years. But she said that she saw something in me that will flourish as a nurse.
That's so cool.
That's very interesting. You're a mother,
Yeah.
so you would know,
Yeah.
like when you see your child,
Yeah.
like what are they good for?
What are they going to be good at?
Yeah.
Oh, yeah.
Yeah.
That's true, because I have this little girl, two and a half, and she has a personality about her, and I'm like, I can't quite figure it out yet. I know she's very musical. She stands her ground. She's very loving, and she loves to give hugs. She loves people, so her social skills are bar none. I mean, so I'm like, okay, so what are you gonna be? Like, I don't know, a social musician? I don't know. What is this?
You still have many years.
Like, I don't know what you're gonna be. I don't know, but we're still praying on it. We'll figure it out. But it's really cool that your mom saw that in you and really encouraged you along that journey, because anyways, not every one of us got that. So it's an amazing thing
I'm grateful
to hear. All right, so let's move over to playing our game. Are you ready?
I'm ready.
Okay, you better be ready.
Let's do it.
This is it. All right, so let me give you a little quick gist about the game. For those who haven't heard, I have a jar with me, and I have different categories in here. And I'm going to shake it up, different categories of TV shows or movies or whatever. And when I shake it up and pick one, Jiwon, you have to create a show that features nurses or a nurse in the lead, and just talk to us about how we would like to be portrayed in media, right? Because we want to change the narrative of the typical sexy nurse, or the nurse who doesn't really have much to say on these shows, and want to create something different, but just do it in a playful way. Okay?
Okay.
All right. Yeah. Let's shake it down. Ooh, I hope I pick K-drama. I'll be so happy.
There, K-drama is one of them.
That's a stereotype, but for real. Okay, your category is reality TV.
Awesome.
Drama, but
I love reality. Reality. I want to combine two shows.
Okay.
Shark Tank.
Oh.
And it's a Korean show called I'm Solo.
Oh.
So it's basically a dating show.
Oh.
of 5 men and 5 women trying to get to know each other for the next 5 days in a like cabin or somewhere.
Yeah.
And then they go on dates. So the show I want to create is that it like 5 to 10 nurse entrepreneurs, they go to this island and then they get to know each other. It doesn't have to be romantic like I'm solo.
Yeah.
They go on like friendly dates. They live with each other for 5 days and they learn about their ideas, their visions, and also in the 5-day course, they pitch to sharks.
Wow.
So maybe at the end of the 5-day trip, they can partner with each other or they can get investment from the sharks. But the point is that I want to portray that the nurses can go beyond direct patient care and we have so many problem-solving skills. And maybe we can do like games in the island too.
This is so good. Oh my goodness.
Because like I want to like portray a different facets of nurses other than what's portrayed in like Grey's Anatomy or different. Jackie, is there another
Nurse Jackie? Yeah,
Nurse Jackie.
Yeah.
The clinical side of nurses, because we have so many potential from working and meeting so many different patients and the teams in hospitals or clinics, and that we always find solutions to problems that we encounter that's unexpected.
Oh, yeah.
So that's what I want to
love it. Oh, that was so unexpected. I feel like we can name it, Shark Tank. We can name it Think Tank RN.
Think Tank RN. There we go. I like that. And you'll be on it, Noah.
Yeah, I'm already there. The name, so
maybe we can go to Jeju Island.
One other place I wanted to go was Jeju Island, and I didn't get to go. And I was watching this show called When Life Gives You Tangerines, and it was based in Jeju. And I was like, first of all, I just complained the whole time. I was like, you see, we could have gone to Jeju. Enjoy the one you got. But yeah, that would have been so cool. Thank you so much for sharing your story and empowering us to know that we are able to diversify our incomes and not to remain stuck in just one way of producing or providing for our families. There are so many things that we can do as nurses, as people. I was just talking yesterday about a life insurance kind of investment strategy with somebody who is a licensed life insurance agent. And so diversifying your income is important. We don't learn that in schools, but I wish that more people would talk about it and teach it to professionals. So thanks a lot for sharing that. If you could suggest one person to be a guest on the show, who would it be?
Oh, I would recommend Beth. I can connect you with her.
Okay.
She is a nurse entrepreneur. She was in academia. She was a professor. Now she is running a venture capitalist firm for nurses. So she invests in firms that are led by nurses.
Wow. I need to look up with that one.
So I'll ask her if I can.
And where can people find you to connect with you? I know we talked about it already, but just throw out your contact information.
Yeah, you can find me or comment on our videos and Rich Nurse YouTube channel, or you can email me directly at contact@richnurse.co.
Awesome.
Thank you.
And you can find her on LinkedIn as well. That's where we connected. So guys, thank you for tuning into today's podcast. I've had such a wonderful time listening to Jiwon's story, and I hope you guys have too. Please make sure to like, subscribe, and share this with a friend. And we'll see you guys in the next one. Bye-bye.
요즘에는 인공지능으로도 NCLEX 공부를 하더라고요. 태훈님은 RN 라이센스 시험인 NCLEX 공부를 위해서 온라인 커뮤니티인 Nurse Builders, Simple Nursing, 그리고 NCLEX 마스터리 등에서 공부를 했다고 해요. 그리고 요즘에는 챗 GPT나 제미나이, Perplexity에서도 NCLEX 문제를 내달라고 하고 공부를 할 수도 있더라고요. NCLEX는 문제를 많이 풀어보는 게 중요하니까 이런 커뮤니티와 툴들을 활용해보세요.
Thanks for hanging with me till the end. I hope you gained some valuable insight into the world of nursing. If today's episode inspired you, please like, subscribe, and share with someone who needs to hear about the amazing work nurses are doing. Let's keep breaking stereotypes and reshaping the narrative together. I'll see you next time.